Very first presenter today is Andrea, who's a post-surgical patient. Andrea?
Good morning. So I'm Andrea, I'm from Indianapolis. And I first realized I was in serious trouble 3 days after my total thyroidectomy, the day of my first ambulance ride. My children, then 5 and 7, watched as I was wheeled nearly unconscious out of the house. It destroyed them. Thankfully, I don't remember much. After I was discharged, my eyes were puffy, I was still shaking, and I was a complete wreck. At this moment, I realized this calcium thing was likely going to be a problem, but what I didn't recognize that my life, as I knew it, was completely over. Like a lot of patients, I had to watch the woman I was slip away, the strong, self-sufficient woman who became a healthcare executive before she was 40, was now frail, insecure, anxious, and simply exhausted. She went from fierce to powerless in 1 week's time. The woman who wouldn't let anything stand in her way was now someone her colleagues and her family were fearful of. She was no longer independent, but now dependent. She's gone, and I still grieve her. I will always grieve her. And I know she'll never, ever return. This disorder was hard on my overall mental health. Every time my calcium fluctuated, my body would go into a fight or flight response. My heart raced, and I was sure I was going to die. It was paralyzing, but now is a warning sign that I recognize. I never appreciated how debilitating anxiety was, and that people really do not have control over it. My family watched me struggle, but learned my cues. When I'm going low, I do what they call birding, which is where my eyes are open wide and I look around with force. When I'm low, my voice quivers. It's something I can't notice, but those around me do. And I hate the quivers because it makes me feel weak. It's a fault that others can see in me, but I can't see in myself. In the early days, I did not take care of my mental health because I didn't understand the constant state of fight or flight, the impact that has on the body. I found a few drinks at night would calm the anxiety, and I'd be able to sleep, finally. Very quickly, the amount to calm my anxiety increased, and I became dependent. I replaced anxiety with addiction in the blink of an eye. I went from a high-achieving woman to rehab in 1.5 years. More traumatizing events my children and my husband had to watch unfold. Once I was completely defeated and beaten into submission, a new woman surfaced. I keep a blood pressure cuff at home so I can check to see if my calcium levels are low enough to require a visit to the ED or if it's something that I can manage to fix with the liquid calcium citrate I keep in the fridge. Every outfit I wear incorporates a belt because in a pinch, a belt works just as well as a blood pressure cuff. I have journals to write in because I can't count on my memory anymore. Yet another defeat. I've learned to use labs located only within a hospital that does not outsource their laboratory operations so that I can get my results in 30 minutes to an hour through an online portal. Thanks to the Cures Act, I don't have to wait for a doctor to tell me what to do. I fix it myself. I learned to talk reasonably and without emotion with the emergency room staff. When they are hesitant to dispense calcium, I ask them questions like, how many people walk through your doors fiending for calcium? What harm would come from infusing a non-fat soluble mineral? I remind them I'm not asking for pain meds and I'm not asking for controlled substances. I am begging for calcium gluconate. I learned to only use one local emergency room so they know me as a patient. When I'm traveling, I now explain to the staff what will happen in a calm way that's not threatening to them, but more informational. While you wait for my labs, I will become very confused. The tetany will spread to my face and my larynx. When that happens, I am a seizure risk, and I will be very, very afraid. I figured out the nurses are my best friends. They truly know what is going on in that ED, and they have been some of my best advocates over the years. I developed, and I always carry a how to help me document, along with a 2-page summary of all of my medications, conditions, and the information the clinicians need, and I walk them through my care. I choose to stick to a very stringent medication schedule as well. I take the same 29 medications and pills, tablets at the same exact time every single day by alarms on my phone. I no longer have the luxury of sleeping through the night because I set alarms to take meds at 1 a.m. and 3 a.m. to space them apart from my calcium. I eat the same food every day because I learned consistency and predictability make this disorder more manageable. In early November, I attended the National hypoPARA conference, and I ate the conference food instead of my normal diet. After the conference, I boarded a 6-hour flight headed to the AAMC meeting in Seattle. I was working on my computer when my heart started racing, and I got that dreaded feeling of imminent doom, and I knew I was crashing. I went into tetany, and I had 5 hours left on that flight. I was terrified, and I knew I was in immense danger. I gave the flight attendants my how to help me documents, and then I had them open my emergency kit for me. The flight crew were afraid, the other passengers were nervous, and I was certain I was either gonna die or I was gonna go viral for causing a flight diversion. Both options were less than ideal in my mind. There's no room for error in this disorder. I did not stick to my plan, and because of it, I put my life in danger. This is no joke. Even for those that have 6 years of experience, we still get it wrong. What I've learned is it's very important that we seek support as we navigate this disorder. It's hard on us physiologically, and we can't think our way out of some aspects of this disorder. As difficult as it is on us as patients, it's even harder on those around us that have to watch us learn to cope with the disorder. My children have long-term implications from what they saw, and my husband will never be the same, and neither will I. The tables have turned, and my children now put me to bed every night before I turn into a pumpkin, they say, and they also help care for me in other ways. I'm always on their mind, and it shouldn't be this way. I'm their mom. I should be taking care of them. I recognize that now I'm strong in different ways, and I have a little bit more empathy. But I know I'll always grieve the woman I was before. I can't forget her. This new woman I was forced to become is holding her own, but her body's tired, and it keeps getting harder. So we need to make things better for those who come after us.
Thank you, Andrea.